is our second session, February 25th, 2021, session 2. We are going to be discussing on the diagnosing hypoxemia and pulse oximetry. As usual, we are going to have our panelists, the directors, Dr. Amos Zakaria, anesthesiologist from Mbeya Regional Referral Hospital in Tanzania. And also we are going to have also Dr. Kaino Mwemezi, anesthesiologist as well, and critical care expert from AIC Kio International Hospital in Kenya. And our co-panelists, we are going to have Dr. Musa Abel from Muhimbili University of Health and Allied Sciences, and Dr. Peter Saria from Comprehensive Community-Based Rehabilitation Hospital in Tanzania. And after sharing the names of the participants, I would like to share with you, Alana, if you can, Sarah, if you can put them in a slideshow, in full screen slideshow. Yeah, so I would like to share with you the etiquette. These are the rules of conduct and the echo session. Just to remind everyone that our programming is based on a foundation of love and respect. Please respond kindly rather than react if you disagree with something. It is everyone's responsibility to keep this webinar a safe space. We will be using the chat function for question and answer at the bottom of the screen. Please send all your questions through the chat box and feel free to introduce yourself. Please turn on your video and make sure that the webcam is positioned effectively to show your face if you're alone, or to capture the whole group. If you have any issues, IT issues that you need assistance, send a message through chat to Echo IT. Also, please be mindful of infection prevention and control and try to limit the numbers of people joining from one gathering place, and also practice physical distancing. Thank you, Sarah. After that, I would like to introduce who will be supporting this session today. My name is Dr. Kevin Raphael. I work with Assist International. I'm going to be the facilitator for the session today. And also from Assist International is Sarah Rumage, who will be assisting us with the chats. And also we have our team from Echo India, Unish and Simran, who are also going to be supporting this session. So I welcome you to the session, and I would like to welcome the panelists, Dr. Amos, to briefly introduce himself and the other co-panelists and give us the way forward as we go. Welcome, Doctor.
Thank you so much. Hi, my name is Amos, as been introduced. I work at Mbeya Zonal Referral Hospital. Na karibuni tena kwenye siku nyingine nzuri, tuweze kuzungumza mambo makubwa, mambo mazuri katika utendaji kazi wetu. I hope that we shall have a very nice talk today. So that's all. Thank you, Kevin.
Thank you so much, Dr. Amos. And I remember we discussed that we are going to start with a poll. So I would like to welcome you, Dr. Amos, to explain the poll and the intention of the poll, and then I'm going to allow the Echo India team to share the poll.
Thank you so much. So, jamani, leo tunaanza kidogo vingine. Kwa hivyo tunaanza kidogo na quiz, lakini this quiz is not, you know, it's not like you're doing an exam. We want to remind ourselves important issues which we normally work with every day. Kila siku tunatumia pulse oximeter. We have oxygen in our hospital. Now we want before we discuss, just to remind ourselves, like what do we know pertaining to pulse oximeter and issue of oxygen. Kwa hiyo, I would wish to invite you. Now, Dr. Kevin, now can we start?
Yes, I think the poll is on display, yes. So the participant can go ahead and answer the poll.
Yes, please.
Yeah.
So we had a question addressing like is the poll on?
Yes, the poll is launched and the participants are giving the answer.
Oh yes, very good. So the STEM question was asking, can I have the STEM question? What was it asking for?
Hemoglobin level in the blood.
Yes, please. Okay, thank you.
The results are launched.
Okay. So I have a difficulty of viewing the STEM question, please, because I can see the answers, but the STEM question, what?
Sir, I think we have only option one of the first question displayed.
Yeah, but it's true and false, hemoglobin level in blood, but what is it asking? I think the STEM question. Do you have that, Sarah?
It's asking the pulse oximeter measures hemoglobin level.
Yes, please. So the question was asking pulse oximeter measures what? So hemoglobin level in blood. So I think majority have said true. So it measures hemoglobin level in blood, and others are saying false. So in fact, hemoglobin level pulse oximeter will measure the percent of hemoglobin, yes, in blood saturated with oxygen. Okay, next. Then next was asking can you go to the number 2?
Yes, the poll is launched for number 2.
Yes. So the pulse oximeter measures what? The amount of oxygen contained in the blood. So, well, so we can give them 30 seconds. Okay, so good.
The
So
result
the
have been
results,
shared. Okay.
so the results, majority again, 9% suggest that the pulse oximeter measures the amount of oxygen contained in the blood. So you have to know in the blood, oxygen will be in 2 forms: one in a serum, and I mean free oxygen, and the other one is combined with hemoglobin. Okay. So next, please.
Poll is launched.
Okay, so the pulse oximeter measures again what? So you can put true or false. Okay, thank you. Thank you. So let's have the results. 82% got it correct. That's correct. Percent of hemoglobin saturated with oxygen. Of course, that's what pulse oximeter measures. Next, please. Thank you so much. So does pulse oximeter measures pulse rate? Again, let's view the answers. 30 seconds. Great. All right. So, okay. So 46 people said yes, measures pulse pulse rate. That's true. What you can see on the pulse oximeter will be normally oxygen saturation and pulse rate. That's true. Should we go to the next question, please? So does pulse oximeter measures cardiac output? Okay. Again, let's respond. Perfect. That's good. So 14 people are saying, well, it can tell you more about cardiac output, but the majority do say, well, it's no, it cannot tell you cardiac output. So, well, pulse oximeter cannot tell you exactly the cardiac output, but it can give you a clue indirectly, like what is the cardiac output, but itself cannot tell you that. Thank you so much for your answers. Can you go to the next question, please? So is the following statement true about oximeter probes? So let's hear from you. Great, thank you so much. So the ear probes, whether you put on the finger or on the ear, there is no difference. So it's false. It's false. So there's no difference. You can put on the finger or on the ear. There's no difference. So the answer is false. Thank you so much. Next. Okay, so let's see. What's all about probe? Is the probe expensive? Thank you so much. So, okay, so 52 are saying is true, and 27 are saying it's true, and 35 are saying no, it's not expensive. But let me tell you, among of the parts of the pulse oximeter, which is very expensive, and you have to keep it nicely, as which I discuss later on, is a probe. So the answer is true. Yeah. Next. So let's talk about the probe can be cleaned gently with the soap water. True or false? Can you clean a probe with a soap water? Thank you for responding. So saying force, very interesting here. So one of the methods you have to clean the probe is using a soap water or an alcohol, so we shall discuss this one in detail later on, but that's a good response anyway. Let's continue. So what's true about oximeter probe? If a signal is not present, then the probe is always faulty. Can we answer, please? 30 seconds. Thank you. Thank you. Great. Great. So, okay. So if signal is not present, majority are saying, well, the probe is always false. Majority are saying no. I would agree with them. Not always that the fault is of the probe. The fault might be anywhere else, as we shall discuss later on. Thank you so much for answering these questions. Next, please. Okay, so how about nail vanish? Okay. Thank you for answering. Great. Okay. Okay, so, well, nail vanish does not affect probe function. Majority are saying false. That's true. Nail vanish normally will affect the measurement. Thank you so much. Next. So how about dark skin patients? Can this cause false reading on the pulse oximeter? Okay, can you try, please? Thank you. That's great. Okay, so majority are saying false. I agree with them. The color of the skin, whether you are from USA or from Tanzania, whether you are dark or you are white, this won't affect how the pulse oximeter reads. Thank you. So I think because of time, I would wish that we end up here, and we shall be revisiting these questions as we continue with our presentation. So thank you so much for your responses. We wanted just to get, to refresh our minds. If we have, we remember what does the pulse oximeter do. So let's end up here and let's start our presentation. So we have a case here, and I'll welcome you to pay attention to this case. A 57-year-old man who presents with the chills, weakness, and a dry cough. And this is a continuation of the last session. And the objective of today's discussion, we want to know how to use the pulse oximeter during the COVID-19 pandemic.
Dr. Amos, sorry to interrupt. You can use Kiswahili also as much as you can, because of the participants here would follow the session more clearly if it's in Swahili.
Thank you so much. Nilijisahau nadhani. So can you scroll it down? Can you scroll down in the yes please. Kwa tutaangalia namna ya kutumia pulse oximeter na namna ambavyo pulse oximeter inafanya kazi, lakini vile vile tunajua kwamba tunapokuwa tunatoa oxygen kuna zile oxygen delivery devices. Kwa hivyo tutazungumza vile vile namna ya kuchagua oxygen delivery devices vizuri. Lakini najua watu wengi tuna pulse oximeter. Okay? Tutajua namna ya kutumia pulse oximeter vizuri, na wakati ambapo unatumia oxygen halafu na pulse oximeter, namna gani una titrate. Okay? Namna gani una titrate. Halafu tutazungumzia type of oxygen supply tulizonazo kwenye vituo vyetu, na kama ukiwa na pulse oximeter, je, unajua kuitumia vizuri? Unajua kinachoandikwa pale? Na matumizi mazuri hasa ya pulse oximeter ni nini? Kwa ujumla tutazungumzia kuhusiana na matumizi ya pulse oximeter ku diagnose hypoxemia. Next please. Next slide. Okay, so wacha tuzungumze hasa kesi yetu. Our 57 years old male patient present with 4-day history of chills, weakness and a cough. Na kama tulivyoona the last session, his wife was tested positive for COVID, and the patient comes with oxygen saturation of 89 at home. So his wife sent him to the emergency department. Na mgonjwa akawa pale kwenye EMD, akawa isolated. Na wahudumu wakawa wamevaa face mask zao vizuri. Sasa wewe na nursing student mmejiprotect vizuri, mmevaa hizi PPE. Na patient admits kwamba anasikia shortness of breath. Akiwa anatembea au akiwa anakula, lakini anasema hana homa wala akiwa ametulia hana shida. Now I want you to invite you to take at these to look at these vitals. Heart rate is 95, and the blood pressure, now blood pressure ni 95/52. So the rate is 24. Saturation is 89. Temperature is 36.5. This is the case. So looking at this case, it's obvious from the previous discussion, we knew that this patient was hypoxic and was kept on oxygen therapy using a nasal cannula, 5 liters per minute. Okay. And his oxygen saturation improved to 97. Now, can we please put our answers on the charts just for 30 seconds? How do you think pulse oximeter will help you in a patient like this? What is the role of pulse oximeter kwa huyu mgonjwa? Itakusaidia vipi? Just for 30 seconds. Andika hapo haraka haraka. Okay. All right. Asante. So, thank you, David, to determine when to give oxygen. Thank you so much. To know the oxygen saturation and the pulse rate. Thank you, John. It will help to know level of oxygen saturation. Thank you so much. Your answers are great. Your answers are great. So, pulse oximeter, it will be a very important tool to alert us, kutufahamisha kwamba mgonjwa wetu anaendeleaje. Kwa hiyo ni kama kifaa ambacho inatusaidia kujua maendeleo ya mgonjwa na tufanye nini kwa mgonjwa. Okay? Next please, next slide. Okay, thank you. Okay, so can we now look at this video and see the proper way of using pulse oximeter in a patient like this? Just 3 to 4 minutes. Karibuni tutizame.
Kevin, the sound is unavailable. Can you just share the screen with the cheers sound?
Okay, can we watch the video, please?
I don't know if you can hear the sound in the video.
I think I cannot hear personally.
Okay.
Rates and administration practices will vary according. This video shows the use of a pulse oximeter in the context of the COVID-19 pandemic. Severe COVID-19 primarily affects the lungs. Measuring oxygen saturation is essential for deciding when to use precious oxygen resources during the pandemic. A pulse oximeter is used to measure oxygen saturation and can help identify severely ill patients who should be hospitalized and receive oxygen therapy. Please note, available oxygen, flow rates, and administration practices will vary according to local protocols and resources. Make sure you know what kind of oxygen therapy is available in your institution, how it can be delivered, and what local guidelines are in place. Do you need to measure your patient's oxygen saturation? You will need to decide whether your patient should have their oxygen saturation measured. To decide, you will need to ask 5 questions. 1. Does your patient have a fever? 2. Does your patient have a cough or difficulty breathing? 3. Does your patient have an increased respiratory rate? 4. Does your patient have any emergency signs, such as obstructed or absent breathing, severe respiratory distress, central cyanosis, shock, coma, convulsions, or uncontrolled vomiting? 5. Is your patient being admitted as an inpatient? Fever. Any known fever over the last 14 days is an indication to measure oxygen saturation. Cough or difficulty breathing. Any cough, difficulty with breathing, or shortness of breath over the last 14 days is an indication to measure oxygen saturation. Difficulty breathing can be any abnormal breathing pattern, including but not limited to breathing too fast, too slow, too deep, noisy breathing, labored breathing, or any pain or discomfort associated with breathing. Increased respiratory rate. An increased respiratory rate is an indication to measure oxygen saturation. This is a little more complicated than the other reasons to measure saturation, as normal respiratory rate varies with age. Let's spend a little time here reminding ourselves of abnormally high respiratory rates in different age groups. In adults and children 16 years of age and older, a respiratory rate of 22 breaths per minute or more is abnormal. In children 5 to 15 years of age, a respiratory rate of 30 breaths per minute or more is abnormal. In younger children from 1 to 5 years of age, a respiratory rate of 40 breaths per minute or more is abnormal. In infants 2 to 11 months of age, a respiratory rate of 50 breaths per minute or more is abnormal. In neonates and very young infants up to 2 months of age, a respiratory rate of 60 breaths per minute or more is abnormal. Any patient who has an increased respiratory rate should have their oxygen saturation measured with a pulse oximeter. Emergency signs. Emergency signs are an immediate indication for admission and resuscitation, including administering oxygen therapy. Resuscitate, administer oxygen, and measure the patient's oxygen saturation if any of the following signs are present. Severe respiratory distress. Signs of severe respiratory distress can include obstructed or absent breathing, head nodding in younger children, nasal flaring, grunting, usually in younger children, tracheal tugging, intercostal retraction or inward pulling of the skin between the ribs during inspiration, and deep lower chest wall indrawing or inward pulling of the skin below the ribs during inspiration. Other emergency signs include poor perfusion or weak pulse, which is a sign of shock, coma, convulsions or seizures, or vomiting all food and drink and medicines. If your patient is being admitted to the hospital with suspected or confirmed COVID-19, or for any other respiratory illness, use a pulse oximeter to check oxygen saturation, along with vital signs.
Dr. Amos, is that enough? Dr. Amos, is the video enough?
You're on mute, Dr. Amos.
Yes, please. It's enough, I think. Well, so this video tells us one thing, kitu kimoja, kwamba pulse oximeter ni muhimu sana kwa decision making. So it's a decision making tool. Okay? That's true. So you need to have your pulse oximeter when you want to make a decision. Kwamba huyu mgonjwa inasoma ngapi saturation. Je, ni mgonjwa wa kutizama, nini kinaendelea, nimwekea oksijeni kiasi gani? Okay? So the next talk, we want now to discuss concerning how now will you start giving oxygen. When you give oxygen, your patient is hypoxic. Does normally oxygen saturation increase fast? Dr. Abel, naomba ni ukaribishe kidogo upite katika haya maswali katika kutoa oxygen kwa wagonjwa. Ni kwa muda gani hasa oxygen itapanda? Na vile vile tutatuzungumzia namna ambavyo una exacelerate kwamba unataka sasa mgonjwa umempa oksijeni haipandi, umempa haipandi. Target yangu haswa niende mpaka ifike ngapi? Dr. Abel, naomba niukaribishe upitie haya maswali mawili na kuzungumzia kuhusiana na vifaa hivi ambavyo tunavitumia unapokuwa unajaribu kumpa mgonjwa. Target yako unataka ifike kiwango gani? Okay? Na how much oxygen do you give? Na what oxygen delivery devices do you use? So Dr. Abel, karibu sana. Dr. Abel? Dr. Abel, are you with us? Okay, so it seems Dr. Abel is not with us.
He's with us, but he's muted. I don't know if
okay,
he can
so
unmute.
Dr. Abel, can you unmute yourself, please? Okay, labda atatukuta njiani. Naomba ni...
No, okay, Amos. Thank you very much. Actually, I was not able to unmute it. The host only was able to do that for me.
Asante sana.
Habari ya jioni wenzangu. Kama ambavyo imesemwa juu ya pulse oximeter. Kama kawaida, mimi mara nyingi huwa nazungumza kwa vitendo. Alright? Na slide iliyopita inatuonyesha ni jinsi gani ilivyo muhimu kwa wewe kuwa na pulse oximeter. Kwanza cha kwanza ni washauri. Ukiachana na mashine kubwa kama hizi, kuwa na mashine lese kubwa kama hii, still bado una uwezo wa kuwa na mashine kuna vile vidogo vidogo vipaza oximeter ambavyo una uwezo wa kukibeba mkononi, na they are cheap, very cheap. $5, $7 unaweza ukaagiza eBay ukawa na hiyo pulse oximeter. Can we go back to the slide please? Amos. Now, kama tulivyoona kwenye video, unapokuwa na pulse oximeter yako, napenda kuwa na pulse oximeter kila mahali, niwe emergency, niwe ICU, niwe theater, all right? Hata kama ninaona wagonjwa clinic, I have my little pulse oximeter kama hapo unavyoona hapa sasa hivi. So I have it all the time. Na ni kwa nini napenda kuwa nayo? Ni kwa sababu kama video ambavyo tumeonyeshwa, pulse oximeter na uwezo wa kunipa information nyingi kutoka kwa mgonjwa, japokuwa naweza nikaona mgonjwa yuko okay na anatembea na amekuja mwenyewe, au naweza nikatoa tu mfano wa haraka. Leo nimeitwa emergency, nakuta mzungu amekuja mwenyewe, anatembea, yuko vizuri, yeye mwenyewe kama mwenyewe. Kupima oxygen saturation yuko na 56. All right? Respiratory rate counting is around 30. So you can see how this, was in need, pasipo kujua, but a simple device like this one was able to quickly activate the whole team to start dealing with that patient. Now, unapoamua kutoa oxygen, nini unachokitarget? Kwanza nianzie kule nyuma ambapo imezungumziwa kuhusiana na hemoglobin. Oxygen na carbon dioxide. Carbon dioxide usafirishaji wake ni rahisi zaidi ukilinganisha na oxygen. Usafirishaji wa oxygen uko a little bit complex kwa sababu unatarajia kuwa bound na hemoglobin. Hemoglobin huwa tunaipima kwa njia ya gram, isn't it? Now 1 gram is capable of carrying around 1.3 something hemoglobin. Oxygen mils. All right? Na kiwango cha hewa safi kinachozunguka mwilini kitategemea zaidi kiwango gani cha hemoglobin mgonjwa alichonacho. Na ndio maana kwa wale wanaofanya anesthesia, mgonjwa anapokuwa na hemoglobin iko chini, let's say chini ya 10, unaanza kuwa na wasiwasi kutoa anesthesia kwa sababu kuna uhakika na namna gani hewa safi itabebwa wakati wa anesthesia mgonjwa anapokuwa amelala. Sasa unapoanza kutoa oxygen, kwa wale ambao tuna practice, kuna wale wengine unaotoa tu oxygen mara moja baada ya kuanzisha lita yako let's say 2 by nasal plumb, anatoka kutoka let's say kwenye 89 tuliyoiona kwenye hiyo kesi yetu, anapanda let's say mpaka 95. You may be comfortable within maybe 5 minutes, 1 to 5 minutes alishapanda mpaka 95. Lakini umeweka nasal plumb yako, umefungulia lita let's say ukaanzia lita 2. Mara nyingi watu tunasema anzia chini ili uwe unapanda kulingana na uhitaji wa mgonjwa ama kulingana na target unayoitaka. Umeanza na lita zako 2 au 3 na nasal plumb, alikuwa na saturation ya 85. Ndani ya dakika 5 za mwanzo amefika 86. Dakika 10 bado anachezea 87, na ukiangalia hapo ina hang, mara inarudi 85 ulikoanzia. You are sure that you are not achieving what you want. Ideally you have to increase. Ulikuwa na 3 enda mpaka 5. Alright? Ndani ya muda dakika 5 huoni mabadiliko ya wayo yoyote. Dakika 10 hakuna increase, na tunajua nasal plumb au cannula zaidi ya lita 5 unaanza kuumiza mgonjwa badala ya kumsaidia. Alright? Zinapofika lita 6, ukipandisha lita 6, lita 7, ile flow yake inakuwa na maumivu zaidi ya faida. Utamkausha njia ya hewa na mambo mengine ambayo hayatakuwa yanatakikana yatazidi kutokea. So baada ya kufika ile limit, ni muhimu sana kujua device unayoitumia na limitation ya flow lita unazotakiwa kuzifungulia. Kwa hiyo ukishafika 5, 6 unaona hauna improvement na nasal plomb, then you have to advance. Tafuta mask, okay, face mask, ambayo hii face mask itakuruhusu kufungulia lita zaidi ya zile 5 mpaka lita 10. Face mask bado inaruhusu kwamba ile oxygen uliyoifungulia utakuwa na uwezo wa kuvuta kiasi cha oxygen kilichofunguliwa, lakini bado face mask huwaga ina uwazi pembeni unaoweza kuruhusu some of the room air ikachanganyika kidogo na hiyo oxygen unayoivuta. Alright? Umekaa, ulikuwa na saturation yako ya 85, umeweka kwenye oxygen mask. Alright? Respiratory rate says ilikuwa ni 34. SpO2 ilikuwa inakuonyesha 84. Nao uko kwenye mask. Probably alikuwa anatumia accessory muscles. Alright? Umeweka kwenye mask ndani ya dakika 5 mpaka 10. Respiratory rate unaona inashuka from let's say 34 you are going to 28. SpO2 inapanda, let's say from 85 is going to 90, 92. All right? The use of accessory muscle is going down. You are assured kuwa hata kama kiwango cha hewa safi bado kinapanda polepole, but to some extent you are almost reaching where you want. All right? So, kama ulikuwa na lita zako 8, you can maintain with 8 liter. Nasema tumpe muda tumtizamie. Nilichojifunza kwenye COVID cases, you may put them on mask on the first 10 to 20 minutes. The increase in oxygen saturation, not that much appreciated. Give half an hour, give an hour, utakuta amesaturate mpaka 100, especially tunapoweka kwenye CPAP. So give it a time. Kishaona zile signs za uhitaji zinaanza kushuka, unajua I am there. So not necessarily uwe pushed na ile saturation kwamba I'm still 91, I want to reach it 95, I want to reach it 100. But you see the respiratory effort is going down. You see the use of extra muscles is going down. The patient was sweating, now is even able to look at you, is even able to start, giving those words like labda nahitaji maji, because normally you'll find like they're in a certain need, nahitaji maji. Like you are reaching there. Ama in some other areas, like we saw in the videos, a patient is having convulsions, all right? Why are we supposed to give oxygen to this patient? Or a patient is in shock, all right? Or the patient is in certain condition, sawa sana tulizoziona kwenye video. Ideally, tunasema kwamba kile kiwango cha hewa safi unachokitumia, in a normal circumstances, you are using around 1/4 ya hewa ninayoivuta hapa sasa hivi. Lakini ninapokuwa na conversion ama ninapokuwa kwenye state ambayo ina increase my metabolism more than the normal one, the demand goes higher. All right? Kama ni conversion, nina uwezo wa kutumia mara 4. Kwa hiyo tunataka utoe oxygen ili at least to meet that demand which will increase depending on the condition which has happened to the patient to impose more demand.
Dr. Abel.
Yes, Amos.
Samahani, nitaukata kidogo, nadhani nitakualika tena. Naomba tuende kwenye next slide sasa.
Okay.
Yes, sasa Dr. Abel ametufundisha vizuri na kutuelezea oxygen delivery devices and when do you need to escalate, kwamba hapa hafiti vizuri kwenye nazo cannula, ameenda kwenye simple face mask, lakini alichosisitiza ni kwamba usilashi, kwamba nimemwekea maski mgonjwa hasatuti vizuri, una change. There is that room of waiting and see the response. Okay, so normally huwa tunasema when you put a patient on oxygen, normally the pulse oximeter, it has a latency kati ya sekunde 30 mpaka dakika 1 kuweza kudetect any increase ya oxygen ambayo umempa mgonjwa. Kwa hivyo lazima uwe na muda mzuri wa kusubiri dakika za kutosha kuona response unavyokuwa unampa oxygen. Na can we go to the case update? I think Dr. Abel has done a great job kwenye kuelezea, you know, how we really use these oxygen delivery devices. So let's go to the case update. Oh yes. Now our patient is diabetic, type 2 and HIV. Of course, was on medication and had inguinal hernia repair. And, you know, on our social history, you know, in an occasional alcohol drinker, but does not smoke. Sasa, naomba tuweze kuendelea na hii case sasa. Mgonjwa ni huyu, na nesi anakuuliza, kwani hii oxygen unayompa huyu mgonjwa, kama Dr. Abe alivyokuwa anazungumza, inatoka wapi? Where does the oxygen come from? Sasa nataka kuwauliza participant, kwenye study zetu normally we have different source of oxygen. Dr. Saria has spent many days, you know, trying to travel kwenye hospitali sana za wilaya na za vituo vya afya kuangalia wana sources zipi za oxygen. Dr. Saria, karibu, utupe uzoefu. What are the common source of oxygen do we have in our setup? Dr. Saria, karibu na utupitishe kwenye hizo source of oxygen na kidogo changamoto zake na vile ambavyo tunazitumia. Karibu Dr. Saria. Dr. Saria? Dr. Saria, please, can you unmute yourself?
Yes, Amos, how are you?
Yeah, I'm good. So, Saria, the question was asked, like, share the experience. You've gone to different healthcare facilities. What oxygen source normally do we find there? And what are some of the challenges you've met when you visiting these, you know, hospitals? Karibu.
Okay, thank you very much, Amos. Umetuambia tuongee kwa Kiswahili, right?
Karibu kabisa.
Okay, asante. Source mbalimbali, kuna source mbalimbali za oxygen. Kuna vyanzo mbalimbali vya oxygen katika mahospitali ambao vinatumika. Chanzo cha kwanza of course ni room air ambayo tunavuta mimi na wewe na wengine wote. Hiyo ni mojawapo ya source of oxygen. Lakini tunapozungumzia kwa wagonjwa, tunazo modality mbalimbali za kuhakikisha kwamba tuna deliver oxygen kwa mgonjwa. Ya kwanza ni kwa kutumia zile ambazo tunaziita ni oxygen concentrators, ambazo majority of the district hospitals au majority of our hospitals ndo wanazo kwenye vituo. Oxygen concentrators zipo za aina mbalimbali, tutadiscuss in details. Na source ya pili ni kwa kutumia zile oxygen cylinders. Tunazo oxygen cylinders za size tofauti. Na source ya tatu ni kwa kutumia zile ambazo kwa nchi yetu hapa tunaweza tusionazo. Tuna zile storage tanks au zile liquid oxygen ambazo zinakuwa stored kwenye matanki makubwa. Na kwa hospitali wanaweza kuwa na zile manifold oxygen cylinder manifolds ambazo ni cylinder nyingi zimekuwa zimekuwa arranged in series, zinakuwa zinatoa oxygen. Lakini kwa vitu vyetu vingi tunatumia oxygen concentrators au oxygen cylinders kama zinavyoonekana hapo kwenye tank, kwenye picha. Tunazo picha ya concentrator, tuna ya oxygen cylinder, tuna ya manifold na tuna hiyo liquid oxygen ambayo ipo kama inavyoonekana hapo. Kwa hiyo kila moja ina faida na hasara yake. Tukianza na oxygen concentrator ambayo most of the time tunaitumia, ni kwamba faida yake ni kwamba inaweza ikanunuliwa kwa mara moja, alafu ikawa ina concentrate oxygen kutoka kwenye atmospheric air. Kwa hiyo unachohitaji wewe ni kuwa na source of power, either electricity or generator or solar, ambayo inaweza ikarani hiyo oxygen concentrator. So once you plug the concentrator to the electricity or to the source of electricity, yenyewe itakuwa ina concentrate atmospheric air 21% na kuconcentrate kuifanya at least itupe percentage kubwa ya oxygen. Sasa itatoa percentage gani kubwa ya oxygen itategemea na wewe maintenance yako ya hiyo oxygen concentrator. Unazofanya zile preventive maintenance vizuri, ndio jinsi itavyokuwa inakuzalishia oxygen vizuri. Lakini a very good working concentrators can give you up to 95 or 96% ya oxygen. Nyingine zinaweza zikakupa mpaka 99% ya oxygen, lakini kadri zinavyotumika sana bila kufanywa maintenance, kiwango cha oxygen kinachotolewa kwenye concentrator kinaenda kikipungua. Kwa hiyo ni vizuri tukawa tunazicheck zile concentrators zetu kuhakikisha kwamba zinatoa kiwango kizuri cha oxygen kwa kuwatumia wale biomedical engineering. Wao wanafanya zile test kwa kuingiza zile, kuna test wanazofanya kuhakikisha kujua kiwango cha oxygen kinachotolewa kwenye concentrator. Tukawa tunafanya zile planned preventive maintenance na uwezo huo. Lakini of course disadvantage ni kwamba kuinunua kwa wakati mmoja inaweza kuwa ni gharama. Tunazungumzia mamilioni milioni za fedha za Tanzania, za milioni 4, milioni 5, inategemea na aina ya concentrator, nyingine mpaka milioni 8. Lakini ukishainunua kwa mara moja, hauna haja ya kurefill oxygen kama ambavyo ungekuwa unazirefill kutoka kwenye oxygen cylinders. Kwa hiyo hiyo ni concentrator. Kwenye cylinders kama nilivyosema, zinaweza zikawa ni rahisi kuzinunua, zina range nafikiri sina uhakika zaidi, lakini kati ya 200,000 mpaka 300,000, 400,000 kuinunua ile cylinder, lakini utabidi huo unairefill kila inapoisha. Sasa kwa wagonjwa wetu wa COVID ambao wanatumia let's say 15 liters per minute, unaweza ukapata picha kwamba cylinder moja inaweza kukaa dakika ngapi? Itakaa kwa muda mfupi sana. Je, tuna uwezo wa kwenda kurefill na kulipa gharama za kurefill zile cylinder kila mara? Kidogo itatuia ngumu financially. Kwa hiyo utaona tena concentrator kuinunua ni gharama at once, lakini inaweza kukusaidia kwenye kudeliver oxygen. Sijui kama kuna swali lingine Amos, au kuna kitu kingine ambacho natakiwa kuelezea. Of course tunaweza hizo manifold ambazo nazo ni cylinder, gharama yake ni kubwa zaidi kwa sababu utahitaji iwe ni system ambayo inakuwa is a wall pipeline system. Lazima install hizo system pipes na cylinders. Inaweza ni gharama at once na lazima uwe una refill kila mara.
Asante sana.
Kwa hiyo nafikiri niishie hapo kwa sasa.
Yes, Saria, thank you so much. Thank you so much. Umetupitisha sehemu nzuri sana. Umetupitisha kwenye different type of oxygen supply available in our setup, na umetukumbusha nini cha kuangalia unapokuwa unachagua utumie nini. Na let me tell participants, we shall have a breakout session baadaye later on kujaribu kuzungumza hii mada kinagaubaga vizuri. Kama una maswali, tutakuwa kwenye vikundi vidogo vidogo na tutaulizana maswali kwenye hizo breakout session. Lakini saa hizi let's so far get a summary of what we have covered up to now, the practice change action. Okay, so tumezungumza kuhusiana na oxygen supply option available, tumezungumza kuhusiana na matumizi ya concentrators na oxygen cylinders, na tumezungumza kuhusiana na oxygen delivery device. Dr. Abel amezungumza hivyo vitu kwa uzuri kabisa, na tumezungumza namna ambavyo tutataka tuendelee kumaintain hivyo vifaa ambavyo vinatupa oxygen. Lakini kitu cha muhimu zaidi tumezungumza kuhusiana na vile ambavyo unaweza ukawa una monitor mgonjwa wako akiwa kwenye oxygen. Sasa let's get the case update as we continue to treat and attend our patient. Karibu. So now, participant, look at our patient. Suddenly, this is the pulse oximeter. The pulse oximeter starts alarming, and inapo alarm, unatizama kwenye monitor yako. That is the screen of the pulse oximeter. and that's what you see. Please, can we take 30 seconds and tell me what is wrong with that screen on the pulse oximeter? Tujaribu kuandika. Can we write on the chat box? Like, what do you think is wrong with this patient? Looking at that pulse oximeter, what do you see? Okay. Okay, thank you. Leonadia says bradycardia. Okay. Okay, so what else do you see apart from bradycardia? Okay, the patient is desaturating, low saturation and bradycardia. Okay, so thank you so much. Thank you for your great answers. That's obvious. The patient is desaturating, and also the patient looks bradycardic. Now, the question is, now I know most of us here, the anesthesia care providers, we have clinicians, we have nurses working in the ICUs. How would you wish to approach? How will you respond to this patient? To answer this question, naomba tena nimkaribishe Dr. Abel, umefundisha sana na kuelekeza mgonjwa akipata hypoxia, hata kama ikiwa ni intraop au yuko theater au yuko ICU. Do we have any structured way of responding mgonjwa kama huyu? Dr. Abel, please, karibu.
Hello, Amos.
Ndio, Dr. Abel, karibu.
Okay, thank you very much. Kwanza naomba nianze kuelezea.
Ndio.
Kama wataalamu wa afya tukiwa na dhamana ya kuhudumia walio na uhitaji, ila tuwe na uwezo wa kufahamu exactly nini unachotakiwa kukifanya. Tunazungumzia pulse oximeter. Pulse oximeter kama pulse oximeter, tuna uwezo wa kuitumia kwa sensi zetu zote tatu za muhimu. Unaanzia sensi ya hearing, which is very important. Now, if you listen to the background, you will hear the sound. Then kuna sense ya visual. Then kuna sense ya touch before you rush into decision. Kwenye sense ya hearing, sauti unayoisikia it normally changes kadri mabadiliko yanapotokea. If SpO2 goes down, the sound will change as well. And if you get used to that, you will be able, utafikia mahali una uwezo wa kusema mgonjwa fulani yuko kwenye desaturation ambayo ni mbaya, ama mgonjwa fulani anaanza kudesaturate just by hearing. And then visual, if you look at your monitor, kama tulivyoona hapo, una uwezo wa kusema mgonjwa sasa naona SpO2 inashuka, naona kuna bradycardia. Lakini pili, naomba ukiangalia kuna hizi tracing hapa. Anyone who is showing the picture, please show the tracing on the previous picture. Please. Yes, I need. Please, can you indicate? Can you show them those tracing? Yes, this is tracing. They are so important, so important. Hizi tracings zina uwezo wa kuonyesha kuwa what you are getting is exactly what you see. Ama kuna uharaka wa kusema something is not okay. Kwa mfano nikiona hiyo tracing is completely irregular. All right? It's easy for me to say, let me start with the other factors. Of course, the quick thing in any situation, desaturation, bradycardia, cha kwanza unaanza na mgonjwa. Look at the patient. Look if there is any sign which is supportive of what you have seen from your pulse oximeter. Kama kuna sign ya desaturation, obviously this patient will be showing the need for oxygen supplementation. Protocol kama tulivyosema, unapoanza anzia chini. Tumia nasoplong au cannula. Start with those liters. Okay? Na unapoanzisha therapy yoyote ni lazima uwe na goal. So the issue there is desaturation. Maybe with the bradycardia, of course, the prolonged desaturation, bradycardia will follow. You don't attend hypotension and then cardiac arrest. So nasoplong umeanzisha, bado haja improve, then you start escalating kulingana na vifaa ulivyo navyo. Utaenda kwenye maski, utaenda kwenye reservoir, utatumia venturi kama una venturi, you will go to CPAP if you have CPAP. You may eventually reach to intubation. Lakini cha muhimu ni kuhakikisha kuwa anza na mgonjwa, yes, the signs of desaturation is there, start managing. There is no signs of desaturation, look at the device. Kuna ile mnemonic tunaitaga A, B, C, D. All right? So A iko kwa mgonjwa, B iko kwa mgonjwa, C iko kwa mgonjwa. Then the devices and other equipment will follow later. So just follow that. Thank you, Amos.
Asante sana, Abel, that's very great. And let me tell you, you know, Abel has given us a very short mnemonic ambao ni A, B, C, D, E. A meaning airway, anything which can obstruct the airway. Labda na secretions, ana chote kile ambacho is really obstructed the air, you have to remove it. Angalia mgonjwa kama is the patient making enough effort of breathing. That's a B. Labda na high spine, hujui. Labda umemparalyze na muscle accident haijaisha mwilini. Kwa hivyo angalia effort of breathing. And then you see, tizama kama na cardiac output nzuri. Je, pressure yake ni nzuri? Je, circulation yake iko vizuri? Nini habari ya capillary fill ikoje? Halafu amesema kuhusiana na D hapa ni muhimu sana. Wakati mwingine watu wanapenda kusema okay, D for drugs. Wakati mwingine when we give anesthetics, anesthetic drugs to our patient, unaweza kama overdose mpaka ukacompromise na respiratory center, akawa na reduce the breathing effort. And then E stands for equipments. Anything, maybe this displacement, if the patient is intubated, labda tube imekuwa displaced, au oxygen sinda yako mwenyewe labda imeisha, haifanyi kazi, labda kuna kinking in the tracheal tube. So what is important, Abel amesema always start with the patient. That was a very nice elaboration. Na amezungumza tutumie sensi zetu. Hii wevu haijakaa sawa. Hii ni kama artifact, ile ambayo ni nzuri inakuwa iko uniform. So it can be artifact, au wakati mwingine kama mtu una code kwenye extremities, hutapata wevu ambayo ni nzuri. Kwa hivyo matumizi sahihi ya pulse oximeter na kujua what you are hearing, ka sauti tu kakiwa kakali zaidi unasema is this patient tachycardic, because it's very fast. Strong loud voice of pulse oximeter inakwambia kitu. Okay, so please, that was a very nice elaboration from Abel. So let's now go to how really we handle our pulse oximeter. So make sure your probe unapomwekea mgonjwa imefiti sehemu yake. Ukiweka too tight au too loose itakuwa ni shida. Okay, so make sure imekaa vizuri. Okay, now let's get to the case update. Okay. All right, so tumezungumzia there are some factors which can interfere with the accurate pulse oximeter values. Hivi tumekuwa tukivizungumza sana. Not necessarily a patient who is desaturating. The problem is, is a patient. Kuna vitu ambavyo vinaweza vikakupa false negative or false positive when the probe is on a patient. Inaweza kuwa ni mgonjwa au ikawa ni pulse oximeter yenyewe. Kwa angalia probe yako imekaa vizuri, imefit au iko loose au iko too tight. If there is a movement, patient is irritable na kuna movement. Kama kuna illumination ya light kwenye kidole kilicho na probe, itaingiliana na ile light emitting diode ambayo ita cause interference. Hautakuwa na reading ambayo ni nzuri. Labda mgonjwa wako amepata carbon monoxide poisoning. Carbon monoxide iko sensitive, iko na affinity sana, ina combine na oxygen mara 100 zaidi kuliko oxygen. Kwa hivyo unauza mgonjwa wako yuko dizzy, kana sweat, lakini pulse oximeter inakwambia ana saturate 99. Kwa hiyo lazima uangalie vitu ambayo huwa vina affect ninapoweka pulse oximeter kwa mgonjwa wangu. Now, possibly, if the probe does not fit nicely to the patient, also can be one of the source ya error, na ukaona kwamba ni nini hapa ambacho ninaangalia nacho. Lakini cha muhimu sana, pulse oximeter ni alert tool ambayo inatusaidia sisi kumanage mgonjwa wetu vizuri. Kuna swali tumeuliza namna ya how do we properly care for pulse oximeter? I mean, do we clean them with, what type of material do we use to clean the probe? The probe of pulse oximeter is the most expensive na important part ya kuweza kuiangalia, kwa sababu kama ikishaanguka tu inakuwa ni shida. Kwa you can clean it with soap na maji ya baridi au na alcohol is spirit, lakini when you are cleaning it, probe ina face mbili, pulse emitting diode na ile detector. Make sure haufutifuti kama vile unafua nguo na unasugua. Unajaribu ku clean it gently. Okay? So that's very important.
Thomas,
yes.
There's a video here. Should we play this video?
I think we have like 2 minutes before breakout. If it is short, then we can watch it, please.
Okay.
Yeah, thank you. So tutizame hii video kidogo, itatusaidia namna ya kuhandle vizuri pulse oximeter na namna ya matumizi mazuri.
Between patients, it is essential that you gently clean the probe and cord with medical alcohol. Small amounts of 70% alcohol-based hand rub will also work, but should be applied sparingly. It's important to keep the LED and photo detector clean. Please also remember to wash your hands, following proper protocol between patients. The oximeter should be wiped down regularly, using common detergent and non-corrosive disinfectant, such as those used in hospitals. Be aware that many kinds of detergents must be diluted prior to use. The oximeter case and screen can be wiped with a lint-free soft cloth or a sponge moistened in detergent. While cleaning the oximeter, be careful not to spill liquid onto the instrument and do not allow any liquid to spill inside the oximeter. When wiping the side panel of the oximeter, be especially careful to keep liquid away from the cable and the outlet.
Thank you, Kevin, for that very nice video. It's short and clear. Now, dear participants, sahizi, we want to go to the breakout sessions. Na tutagawanyika makundi. Na feel free to ask anything concerning the source of oxygen, we have in our facility, matumizi sahihi ya pulse oximeter na interpretation zake, na how do we respond kwa mgonjwa ambaye pengine pulse oximeter inakwambia kwamba kama vile mgonjwa hasomeki vizuri. Kwa hivyo tutakwenda kwenye hiyo breakout session, and let me invite our experts will tell us on how we shall go to those small groups breakout sessions. Karibuni.
You will just receive a request on your screen. Just accept that.
Okay.
Now you can join. You can just do a yes, and you will be joining into the breakout.
Okay. Kwa hiyo kwenye nani yako kama kuna sehemu imekuandika join, wewe just join. Bonyeza pale join na utaweza kujoin. Tunatumia pulse oximeter kudiagnose hypoxemia. Na labda tupate mwakilishi. Can we have representative from group from room 1? Room 1 mwakilishi. Can we share something we have discussed for 1 minute? Kutoka group 1. Yeah, from group 1, can we have someone to talk vipi ambavyo tumezungumza?
Okay, naitwa Heavenson, ni mwakilishi wa group 1 na tulikuwa tunazungumza kuhusu changamoto tulizozipitia. Sisi tupo Bunda Hospital na tumeangalia changamoto tulizonazo ni kuhusu mitungi ya cylinder ile pamoja na concentrator za kawaida. Changamoto kwenye cylinder ni kwamba kwanza tunazo chache. Hii ni district hospital lakini tuna mitungi 3 tu. Na mtungi mmoja unatembea na ambulance. Kwa hiyo tunabaki na mitungi 2 ambayo yote inatumika theater. Na wakati wa kurefill ile mitungi ni mbali. Sisi tuna refill Mwanza na kutoka Bunda mpaka Mwanza ni kilomita 150 plus. Kwa hiyo ni mbali sana kwenda kurefill na gharama inakuwa ni kubwa. Lakini concentrator pia bed zetu tuna vitanda almost 200 hapa hospitali, lakini tuna oxygen concentrator kama 4 tu. Ambazo kwa kawaida zinaweza zikawa ni chache kuliko hata wodi tulizonazo. Kwa hiyo ni changamoto kidogo. Ukikuta wodi moja ina wagonjwa 2, inabidi uangalie priority sasa. Nani atumie, nani asitumie, kitu ambacho ni changamoto kwa hospitali yetu. Asante.
Okay, Dr. Amos, before you go on, I would just like to give a quick interpretation so that Alana can type.
Oh, yes,
so
yes.
Yeah, this was actually group 2, not group 1. So
okay.
The main sources of oxygen that they have at their facility is oxygen cylinders and oxygen concentrator. So they use those. And they have around 5 functioning oxygen cylinders, which they send them to be refilled after they are finished. Also, they have oxygen concentrator, around 8, but most of the time 5 are the ones which are functional. But one of the challenges that they have is that these are usually not enough to meet the requirements that they have for their patients. And another challenge that they face is that the distance for these cylinders to go to be refilled is quite a lot because they have to move to another region. And thereby they have delays in the refilling of these cylinders. I think that's what the participant was saying. Yeah.
Asante sana. Dr. Naima nimekuona. Dr. Naima Zakaria, I don't know in which group ulikuwa. Karibu sana ushare na wewe kwenye group lako what we have discussed. Dr. Naima, karibu please. Dr. Naima? Can you unmute yourself?
Nadhani hawezi. Dr. Naima alikuwa group 1 na feedback zilizotolewa na Kevin.
Okay, basi. Okay. Now let's go group 1. Group 1 ni nini ambacho discuss? Solutions na what were the challenges. Karibu. Group 1. Okay.
Okay, sorry, Amos, if I'm allowed to add something. Hello? Hello?
Naima?
Yes. Yes.
Yes, please. Yes, please. Go ahead. Go ahead.
So, the other challenge which I saw, I'm from group 2, so the other challenge which I saw was even when the oxygen cylinders are being refilled, there is no specific precaution or things taken to know whether the oxygen which is being filled in the cylinder is enough or not. So that is another thing which I saw. Either they do not have the facility, or still, like, it's just they depend mostly on the place where the oxygen is being filled. But when it comes to the facility, there is no way you can know whether there is oxygen in the cylinder is enough or not. So I think that was another challenge which I saw from the those who talked. Thank you.
It seems group 2, you were, there are a lot which you discussed in those 10 minutes. So I know we don't have time, but can we have like group 1 for just half a minute? What did you discuss? Group 1 and followed by group 3. Please, representative, feel free to unmute yourself. Okay, anyone from group 3? Group 3, I think I chaired this group. Anyone wanted to share? Sister Sabina. Okay, from okay, no group 3. Okay, good. So I was in group 3, lakini the main thing was about the oxygen delivery devices. They are not really present. They can only access the nasal cannula and a simple face mask. So if you want to escalate oxygen therapy, you are limited based on the oxygen delivery devices. So it's something we've discussed that we have to be the good ambassadors, educate others on the importance of making sure that we have non-rebreather face mask, CPAP mask, that when you want to escalate oxygen therapy, you have the good delivery devices to help you. That was the main issue which we discussed. Now, thank you guys for your time and your nice discussion in your groups. As we are closing, I will invite Dr. Abel. Dr. Abel, are you with us? Dr. Abel, are you with us? Okay, so let me give the a take-home message, and the practical change objective which we've tried to discuss. So we have the oxygen source, and we have oxygen delivery devices. We have to be wise to choose which type of oxygen source we have based on the type of hospital we are, issue of the economic issues, and how much oxygen do we want to get from that oxygen source. Is it high flow or low flow? So depending on your hospital, you have to advise accordingly. But having oxygen source alone, haitasaidia. You have also to have the right oxygen delivery devices. Ukiwa na hivi vitu, then you will have your pulse oximeter. Your pulse oximeter is a tool which will help you to make a good decision. Okay, whether to bring it down or up, to escalate or to wean the patient from the oxygen therapy. So pulse oximeter is a very important tool. Lazima tuwe nayo. We have to know how to keep it, how to interpret it. Na itatusaidia sana as healthcare providers. So that's the end of our talk today. Back to Dr. Kevin for announcements and other administrative issues.
Thank you so much, Dr. Amos and the panelists. Tunawashukuru sana kwa kuweza kuongoza hii discussion na session yetu ya leo. Natumai kwamba tumebenefit na tumeweza kujifunza a lot kuhusiana na diagnosing hypoxemia na jinsi ya kutumia pulse oximeter. Kwa kufunga kipindi, so for the session wrap up, I would like to remind everyone that you can visit the Learning Resource Center LRC for this presentation, slides, and the recordings that we have been sharing during the session. The site also includes many additional resources like quizzes, case exercises, and videos. So that is the link for the Learning Resource Center. Also, the link to the recording of this session and the Learning Resource Center will be shared after the session by email for those who had registered for this session. You can join our community or the Telegram group by scanning this QR code here, and then you can have access to the WhatsApp group, and then you can have necessary information. So after saying that, I would like to thank all the panelists again, and thank our funders, the Project Echo Institute, and also Assist International and Stanford Medicine Division of Global Anesthesia for making this, for helping us to have this session today. And I would like to welcome you to our next session on the coming month, on March. So thank you very much. Asante, tutaonana kwa mwezi ujao katika session inayofuata. Asante. Kama kuna maswali unaweza ukatuma kwenye email ambayo inaonekana hapa.
Asante sana.
Asante sana.
Okay. Asante.
Asante Naima.
Everyone, I'm just ending the meeting. Thank you.
Thank you, Amos.
All right.
Amos, big up.